I often get patients come to me in great distress that their estrogen levels aren't right, their progesterone levels aren't right. And I have learned to ask, what day was the blood test drawn? Because in my experience, a lot of these tests were done on the wrong day of the cycle and the conclusions weren't right. Hello lovelies, and welcome to another one of my videos in which we'll be talking about what days of your cycle you should have blood tests drawn to check your hormone panel. And the short answer is on cycle day 3, with cycle day 1 being the first day of your period and 7 days past ovulation. On cycle day 3, you're going to want to test for estrogen, LH, FSH, and AMH. And the reason for that is that estrogen, LH, and FSH, you're going to want to have under a certain level to give you an indication on whether your levels are within a healthy range. Sometimes a repeat of estrogen and LH is recommended right before ovulation to see if those levels went up high enough, of course, for ovulation to happen. And AMH is something that is said it doesn't really matter when in your cycle, but I really don't agree because AMH does tend to fluctuate even if it isn't huge. But it could just make that difference for you of whether you have a big enough ovarian reserve left or you don't. So I would definitely recommend having that tested on cycle day 3 if you're getting the other stuff done anyway. Now, 7 days past ovulation is for progesterone, and traditionally progesterone is tested on cycle day 21. But that assumes that you ovulated on cycle day 14, and that is, yes, textbook, but definitely not the case for every woman and also not for every cycle. So in order for you to assess if your progesterone levels are okay, you're going to want to know first when you ovulated and then calculate 7 days after that. If you don't do it that way, you may have ovulated early or late, giving you either the impression that your progesterone levels are too low because they haven't climbed up high enough yet, or they're already declining, or you're being told that your numbers are great because you ovulated a bit later, but right after that progesterone starts to drop, and then you still don't know that your progesterone levels are actually not good enough for you to conceive. So you need to know when you ovulate. And of course this can be done through scans, and this is sometimes done as part of fertility treatments, but that takes up a lot of time, a lot of money, and is usually not done until you're already having issues for quite a while. A much easier way is for you to chart. So if you aren't charting yet, why don't you check out my free Basics to Fertility Charting course. The cool thing is that over 11,000 women have gone through this course. It's like a crazy number to me. But all of these women have learned how to identify their fertile window, which is useful because then you know when you should make love to conceive. But it's also useful so that you know when you ovulated in case you want to have those blood tests drawn, right? If you're already charting and you have a couple of charts lying around, you can actually learn to spot signs and symptoms of low or high estrogen, a low progesterone, abnormal LH levels, and high FSH levels with my chart invitation course. I am so excited to tell you that this course is going live this coming Saturday, and in the first bundle of this course we are covering ideal charts, estrogen dominance, a low progesterone, and low overall hormones, such as in the case of premenopause, menopause, and premature ovarian failure. And I'm still running the special early bird offer, so go and grab that if you're interested in this course and this bundle specifically. There are also a couple of other hormones that are valuable to get tested, but it doesn't really matter when in your cycle you are going to test them. So you could group them together with a progesterone test or with the cycle day 3 tests. And that is the ones for your thyroid, and that is namely TSH and T4. Then there's prolactin, that's interesting for you to get tested. There's a sex hormone binding globulin, and there's vitamin D. Getting these hormones tested can give you a good idea of whether maybe your hormone issues are related to vitamin D deficiency, or whether you are hypothyroid, or whether you might be having polycystic ovaries. Now, if you want to know more about hormone imbalance and how you can treat that naturally, then make sure to click on the playlist on your screen right now. And in the meantime, see you in the next video. Bye!